At age 9, Vuntut Gwich'in citizen Nellie Njootli's kidneys failed, and she underwent a successful kidney transplant. But earlier this summer, Njootli began experiencing kidney issues and traveled to Vancouver for care. Doctors there discovered the 29-year-old's kidney had rejected, and she was ultimately diagnosed with end-stage renal disease, though her situation is treatable.
I was brought to emerge, wheeled upstairs, and I got my central line put into my chest, and dialysis was started right away, and I have been on dialysis since.
Njootli has been in Vancouver since June. 3 times a week, she receives hemodialysis, a process where a machine takes blood from her body, filters out the toxins in her blood, and returns it to her body, just as a kidney would. But Njootli says she's unable to return home because hemodialysis is not offered in a hospital setting in the Yukon.
People want to be near home, near their support networks, near their friends and family when they're going through a health crisis. And there's more than one person in the Yukon who requires dialysis.
While insurance pays for an apartment and a meal allowance, Njootli is living off her savings until she can come home.
Being on dialysis here is a bit of it's just a constant, never-ending uphill battle.
The territory is advocating for home-based dialysis, where patients can administer their own care. But Njootli says it's not an option for everyone. She says she lives alone and wouldn't have help. She also rents an apartment and would have to make alterations, something she's unable to do as a renter.
I believe in our healthcare system to find a way to fill that need and fill that gap.
It's always terrible being taken away from family and friends and having to spend your time in Vancouver, in hospital, away from your loved ones.
Anne Huang is with the Kidney Foundation of Canada, BC and Yukon branch. She says there's typically around 4 to 10 people in the Yukon undergoing dialysis at any time.
The main obstacle of getting an in-territory unit would be the fact that we just don't have enough people who are in need of dialysis right now to justify the cost.
Huang says in-territory care is important because it can take years to receive a kidney transplant. But getting that transplant is life-changing.
The impact of having a kidney rather than be on dialysis means that you can live your life freely as you wish. Being on dialysis means that you're stuck in a hospital. You're going to hospital 3 times a week, sometimes more, sometimes less, but it means you don't have the freedom to do things that you like.
I'm really excited. I miss home, I miss the snow, and I miss the cold.
Njootli is eligible for a less intensive form of dialysis and hopes to be back in Whitehorse in the new year. She's now sharing her story online and through social media in hopes of finding a living donor where she would likely have a better success rate. Until then, it's a waiting game until she can come home.
I'm really excited to get back home and see my friends and family and also get back to work.
Sarah Connors, APTN National News, Whitehorse.